Thank you so much, ladies and gentlemen. It's an absolutely pleasure for me to be here and share with you my thoughts, ideas, and passion. First of all, thanks to Ellie and the Lake Lab Foundation for inviting me. Congratulations for the first 30th anniversary, and I hope many more anniversaries. And thanks for Lynn for supporting all of us. And apologizes for my bad English. You cannot imagine how difficult and challenging it is to lecture in English for the people that are not native English speakers. But I try to do the best, and more important, I feel between colleagues, friends, and people that are sharing the passion, and it makes it very easy. Let's go to the presentation. Well, pearls of wisdom, in my case, it may look arrogant. I prefer pearls of practice, pearls of passion, about nursing, community care, and care that are my passions. I not wisdom, I prefer to share with you thoughts, and etc. I'm a late boomer, son of the baby boom. This is a big challenge in care because in my country, and it seems to me that here, many of us are going to retire. And then it means that it's a problem. I'm on a stage of my life in which many things happened 20, 30, 40 years ago, but at least I'm here. I'm here and I can explain it. And I'm happy to look back. And at the same time, I'm happy also to looking forward the future. And I think that is important. And very important also is to take a step aside for providing a space and not blocking present and future leaders. And here I'm linking with some of my previous speakers. We have talked about leadership. We must create a space for future leaders. And well, in these cases, what we must do is to encourage these future leaders. Challenges of building a multidisciplinary team, past, present, and future. I'm trying to go to this subject. Nowadays, it's essential that we are working in a paradigm that is patients and their environments, healthcare teams, and community environments. This is basic for the multidisciplinary team. I'd like to share with you something that I believe that it's very important, that is the Barcelona's declaration. You know that this year, 26th, 28th of March, we organized the UMA conference with the Spanish Care Society group. We organized, I'm a member of the board of two societies, and there we signed a very important document that it seems to me that it's like a framework for many of the things that we are talking here. The Barcelona's declaration. The Barcelona's declaration emphasizes in the right to access to quality and evidence-based care is a basic human right, essential for preserving the dignity, healthy, and quality of life. A lack of evidence-based care can cause significant variations in health outcomes. Every individual deserves timely, effective care to prevent suffering and promote healing. Seems to me that are things that we have been discussing here. The care of uns is a universal right that must be applied to everyone, regardless of age, health status, economic level, or social conditions, and must be firmly and effectively ensured for the most vulnerable, both in public healthcare and in private facilities. I believe that it's very important because it addresses for many of the things that we are discussing here. This comprehensive care must be provided by transdisciplinary teams, really transdisciplinary teams, with patients and their caregivers and their communities at the center of care. For me, this is philosophy, but it's also very important to act as a framework for what we are saying. The care for individuals with wounds must be grounded in the best available evidence, ensuring that the practice of HCP and institutions rely on the most robust, up-to-date scientific knowledge. people with wounds and their caregivers must receive adequate information about the condition, prognosis, and prognosis of their wounds and the various treatment options, allowing them to fully participate in prevention or treatment plans with their decisions aligned with the preferences and beliefs. And here it seems to me that leg clubs fit with this declaration. The philosophy of leg clubs rely with this, also with this declaration. If you want to access to the declaration, you can visit the IUMA website. You can download in Catalan, Spanish, English, and Italian. And also your organizations, and I invite also the leg clubs to join. We have made a space for joining the declaration, and well, there is a list. There are more than 60 societies, companies, scientific societies, National Health Service Trust, hospitals, etc. You can join it. And then let's center in multidisciplinary team. And I'd like to center in a different approach, from individual or local, national, first world realities in care to considering the world as an object of teamwork. Here we are talking about the first world, but we have a second world, we have a third world, and if we believe if we trust in the Barcelona's declaration, an appropriate wound care is a human right, is an universal right. Let me explain me part of my history. I have been practicing mountain for more than 40 years. Mountaineering, friendship. For me, it's a way of mountaineering. It's a way of seeing the world and the mountain, solidarity, commitment. And in my case, also nursing and care, and decide to give back to the society some of what we have received. Here is my friend Joan. More than 40. Next year will be 40 years going together to the mountain. It's my best friend, mountain best friend, and also in the life. But we are still active. We are still going to the mountain, and we hope to go to the mountain in the future. This picture is in the base camp of the Kanchenjunga. It's at 5,000 meters. It's the third third highest mountain in the world. And as you can see, mountains are challenging for us. Jaume always says that I'll never retire, and now I have a good news for him. I'm going to retire at the end of this year, but I'm not going to retire as nurse and as wound care practitioner, because all your life will be nurse and all your life will be wound care practitioner. He was the financial chief officer in a company. He retired for it, but I have a duty for him that I'm going to explain you later. For us, mountain is like wound care. I was talking with Sylvie this morning. It's a way of living the life. For us, mountains are not like a wound. We have mountains in nice places with nice people living there, and we become involved in there. Some people go only to climb a very difficult peak. We don't like this approach, probably because we are not prepared now. When we are young, it could be. But we like to involve in these environments, and someone talked previously to me to become involved in the social development. It's like health. Health is social development, and we like to be involved in these items. In April, May of this year, we did a very challenging trekking, the Kanchenjunga. It's one of the wild trekkings that exists now in Nepal. I don't like to go to the Everest base camp because it's full of people going there, and no, it's a very quiet. And there, the first day of the trekking, a nursing technician told us about a paraplegic patient in a very remote area with a category 4 pressure injury that had been present for more than 2 years. He told us that the patient is Santalal, you can see here with his wife. And we said, well, now we are going to the mountain, but when we come back, we promise you that we are going to start to work with it. Mountain has another problem, that you have a lot of time for thinking. You are thinking because you talk with your colleague all the day talking, or you are thinking. And well, I had many time ago, I was thinking in setting up a sort of organization, and it was the starting point to know this patient. Okay. As I told you, mountains, sometimes we believe that when you ask to mountain to the people, they say 8,000, the 14 8,000s. Yes, the 14 8,000s are important, like many of the big illness, diabetes, hypertension, etc. But we discovered in this trekking another mountain, a mountain called Janu. Janu is a sacred mountain for the people of the Kanchenjunga region. And sometimes we face major challenges, and as I told you, well-known and recognized diseases. But sometimes there are things that are more challenging, like wound care. In this case, here you are, I introduce you Janu. Janu, it's a 7,000 meter. It's the 13th mountain in the world, and it's really challenging, more challenging than many of the 8,000 peaks. It's like it happens with wound care, that it's very challenging, but people are thinking in other things. Here you have Joan and me looking at this mountain. As I told you, it's 7,700 meters. It's the 32nd highest in the world, and it has an impressive north face of more than 2,700 meters to climb. And for me, it's like wounds are not prestigious, they are not 8,000s, but sometimes they be more challenging than other things. Well, and under this environment, this nice environment, when we came back from the trekking, 7 kilograms less, tons of rice, eating rice every day, tons of rice and liters of tea, then we could treat our patient, we could see him, we visited, imagine to be paraplegic in a remote area with nothing, they don't have nothing, and we could see this patient. He was paraplegic because he had a fall from a tree. The person who introduced us to this patient was a nurse technician, and he told us, I'm treating a patient, I'm paying for my pocket some of the treatment of this patient. We could assess him. I do not know if you have been trekking with a healthcare professional, but we take our pack, and we take our professional pack also, full of dressings, and then we use part of our equipment there to treat this patient. Here you are the first day. This is the day 18, initial assessment. And here it started a dream that I want to share you, and that I promise you that it has a relationship with the leg collapse. We started, 2 months later, we started to set up an organization. We are still setting up this organization. 2 months later, we send a package with dressings, skincare, and a special cushion. 4 months later, last Sunday, the package arrived to the patient. We have learned a lot about customs, about unexpected taxes, about the monsoon season, about political unrest, etc. This is the third world. This is the real third world. We think that you parcel a package and it arrives in 2 days. It takes 2 months to arrive, and you must pay to many people. Well, we are learning. It's question of learning. But now the patient is happy. He has the material for being treated. And we want to treat him for 6 months, but we want to prevent. Once it will be healed, we want to prevent further complications. Nowadays, there are no distances. I can talk with Vincent. Vincent is the nurse aide, and with the cellular, we can talk each other. We can assess him. Now there are no barriers. And as I told you, this is the Janu mountain. And this is our organization, Janu Ferides. Janu Ferides, it's Cura de Ferides para tothom in Catalan, Cuidado de heridas para todos in Spanish, Un Care for All in English. It's a non-profit organization created and led by nurses. with the aim of bringing adequate home care to people in low-income environments, and committed to local and professional development. For us, it's very important to commit the local and the professional development of healthcare professionals in these places, and the development of their healthcare institutions and their healthcare systems. In other words, to extend the Barcelona's declaration to worldwide. We work in several pillars. We try to work to solve problems in patients. We have identified spinal cord patients and pediatric patients for treating, because we cannot treat everywhere. We also want to encourage the development of local professionals or local healthcare professionals, to involve them, to improve home care also in these areas and at an institutional basis. And we also want to work in another aspect, that is to involve our colleagues, to involve our young nurses, not so young nurses, to our students, other medical professionals, in solidarity. And we want to create a framework for working together in these countries and to share. These are our aims. We are in the process of legal incorporation. You know that bureaucracy is hard, but we are working, and I'm happy that we have a patient without being legal, but we have 2 projects that are working. We have a provisional promoting board of directors, and we have individual patients in Nepal and in Cuba. We are planning a project in Ukraine with amputees, with patients with amputations, that they provide them prostheses, but you cannot apply a prosthesis if the patient has the limb with proper healing. We are planning a project in Guatemala with ostomy patients, but we mustn't be naive. We also have problems at home, and we are working in a project in Barcelona, working with homeless. We have poverty very close to home, and we have a project in Chile about leg ulcers. I'm very happy that this is the first formal dissemination of our society and in the leg club, and well, we hope to start the launch and crowdfunding starting in November. And then you say, well, we have invited this fellow to talk about leg clubs, to talk about leg ulcers, etc. And let me move to the origin. No? Well, we have several projects. We believe that the future, in this case, in caring for people with wounds around the world, is not what will happen, but what we will do together. And we move now again to multidisciplinary teams. This is adapted from Jorge Luis Borges. I've been working in Latin America for 7 years, and I have many contacts there. I used to go to lecture there. There I don't have problems because I can lecture in Spanish, except in Brazil. Brazil, it's more difficult. And then I met a pair of colleagues, Puke Home. It's a company run by nurses, and we started to talk, what can we do for improving wound care, lower limb wound care in Chile? And I'm going to present you the Project Chiloé. Project Chiloé is a project that we are setting up in la región de los lagos, lakes region in Chile. Chile, here is the island of Chiloé. Chiloé is in the south of Chile. It's very, very south. It's 1,000 kilometers far from Santiago de Chile, the capital. And in this case, we are working with an entrepreneurial initiative founded by 2 brothers who are nurses, and they are specialized in wound care. They were born in the island of Chiloé, and they are very involved in the local development of this island. And their main focus and expertise is the management of home-based patients in the care of their wounds. As you can see, we try to work with local organizations in order to work there. Here in your left, you can see Chile. Chile is a country that is very narrow and it's very large, and Chiloé is in the south of Chile. This is an island. It's an island that is located in the south of Chile. Their territory is about 9,000 square kilometers, and it has a population of about 180,000 inhabitants. This island is characterized by an aging population living in scattered rural areas and small population centers who receive only basic health care, very, very basic primary health care, but they don't have care, they don't have preventive care, even they don't have nursing care. Many of the care is provided by nurse aides or nurse technicians. In this island, there is a basic hospital. There are three low complexity hospitals, like a sort of primary healthcare teams, and there are CESFAMs. The CESFAMs are primary healthcare centers that are run by the community, and they have basic primary healthcare rural offices. In the hospitals, in the basic hospital, there is no vascular surgeon, there are no care nurses. In the primary health care, there are no nurses specialized in care, and many of the care is provided by nursing assistants. Here you are the resources, and as you can see, there is a lot of distance between the basic hospital and the low complexity hospitals. It's a very disseminated population, and many of the care of these patients, the visits are done with canoes. They need canoes for going and visiting these patients. It means that no diabetic patients, no patients with venous insufficiency are assessed, are treated. They cannot do prevention with these patients. We choose to make an action in Chonchi. Chonchi is a CESFAM where we have a nurse that is keen to be trained, and in this case, in this CESFAM, what we are doing is a plan with several phases. The first phase is to provide a vascular Doppler to the CESFAM in Chonchi and to train a nurse in the assessment of vascular insufficiency and diabetic patients. We want to promote remote support for vascular assessment. And today we were talking about indicators, about figures, and what we want is to try to establish the prevalence of vascular insufficiency and leg ulcers. And with this information, we want to raise awareness about the problem of leg ulcers among professionals and the local healthcare system in the Chiloé island. This is our first phase that we are starting very soon. In November there are elections. We have learned that we must wait for the elections because probably some officers are going to change, and then we start with the new officers, not with the old officers, because if there is a change of the government, then they don't want to do nothing with the previous government. I don't know if it happens here, but in this country, it happens. Phase 2 is to define a protocol for local care of leg ulcers and the use of compression, to train all Conchis CESFAM nurses and nurse aides and GPs in this primary healthcare center, and on the other hand, to define a protocol for specialized care of leg ulcers with professionals, nurses and doctors at Castro Hospital. Now at Castro Hospital, these patients are seen by a surgeon, but he's not specialized on this. And to establish referral circuits from the CESFAMs to the local hospital. Phase 3, no phase 4, it's to extend the model to the other 3 low complexity hospitals, to evaluate the model and to generate and disseminate evidence. And I'm keeping the message of some of the previous speakers, evidence, figures, to disseminate evidence. And the phase 5, it's to implement the leg club model in this area. To implement, probably, we don't know if a leg club or a mobile leg club, but we'd like to extend the leg club model in this area. Well, thank you very much for listening. There are no limits to what you can accomplish except the limits you place on your own thinking. It seems to me that barriers are mental. Now we don't have barriers. I have a sister living in Greece, and we are in touch every week. I have a son living in Prague and grandchildren, and we see every week. I have a niece living in Birmingham, and we are in contact. Now there are no barriers. We have technology that allow us to work. In the UMA, in the opening ceremony, in the speakers' dinner, we did an exhibition of Castellers. I come from Catalonia. We are very strange in Catalonia. We have strange things, and one are the castles, the human castles. And in this case, we had human castles there. But for me, human castles are a real example of what is the working on team. Let me show you. People from different ages, children, young people, teenagers, all working together, working on team. We have learned a lot with biomechanics. We have learned a lot with our mistakes, having falls. At the beginning, the children didn't use helmet. Now they use helmet, they use teeth protectors. Sometimes we fall and we try to learn what happened. Training, simulation, and this is the key of the success. This is one of the most difficult castells. It's a tower of 9. We have tower of 10. But here everybody plays its role. If the children don't be clear, they don't see clear, they don't go up because they are children but not stupid. And if they don't see clear, and this is the key of the success. Working on team, working in multidisciplinary teams, working on teams with different people and with children, with boys and girls, with teenagers, with young adults, with senior adults. This is what we can achieve, and we can achieve what we want. In this case, this is one of the most difficult castles. And well, thank you very much.